This model focuses on the procedures for proper healthcare waste management in healthcare facilities that manage and care for COVID-19 patients. At the end of this model, you should be able to describe the appropriate procedures for the safe management of healthcare waste in the context of COVID-19. The recommended color coding system for waste segregation in Nigeria is black, yellow, red, and brown. Non-risk waste and general waste are to be discarded in black-colored waste containers or bins. Infectious waste are to be discarded in yellow-colored waste containers or bins, and most sharp boxes are sometimes colored yellow. Highly infectious waste, such as the waste generated in the wards for suspected and confirmed cases, are to be discarded in red-colored waste containers or bins. And pharmaceutical waste and some chemical waste are to be discarded in brown-colored waste containers or bins. There is currently no evidence that shows that direct and unprotected human contact during the handling of healthcare waste has resulted in the transmission of the COVID-19 virus. Nonetheless, best practices for safely managing healthcare waste should be followed at all times, including assigning responsibility and sufficient human and material resources to dispose of such waste safely. All healthcare waste produced during the care of COVID-19 patients should be collected safely in designated containers and bags, treated, and then safely disposed of, preferably on site. All who handle healthcare waste should wear appropriate PPE, such as boots, apron, long-sleeved gown, thick gloves, mask, and a face shield, and perform hand hygiene after removing it. All staff who handle waste inside the patient care areas should ensure to wear the full set of PPE, including heavy-duty rubber gloves, boots, and aprons. And waste handlers must also wear protective clothing, including face masks, aprons, boots, heavy-duty gloves, and goggles as required when handling waste. Waste should be segregated at the point of generation. For sharp waste, which include sharp objects and tubing that have been in contact with the bloodstream, these should be placed inside puncture-resistant sharps containers. These containers should be located at arm's length or as close as practical to the area in which the items are used. Solid, non-sharp medical waste should be placed in leak-proof red infectious waste bags and covered bins. The following procedure for waste collection inside the patient care areas should be adhered to for highly infectious waste. First, you must ensure to don the full PPE. Before lifting the waste bag, tie the neck of the red waste bag. Lift the bag gently to ensure that it does not spill over. Place it in another red bag and then tie the neck of the second bag. Take the waste bag and place it at the collection point, which should be just outside the isolation area. The following procedure for waste collection inside the patient care areas should be adhered to for sharp objects. First, you must ensure to don full PPE. Pick up sharp boxes with the lid closed when the box is 3/4 full. Then, place closed sharp boxes at waste collection area. Move to the duffing area and remove PPE following the appropriate procedure, and remember to perform hand hygiene afterwards. Infectious waste should be contained from the point of origin to the point of treatment where it is rendered non-infectious. The packaging should be appropriate for the type of waste involved. Sharps should be placed in impervious, rigid, puncture-resistant containers made of metal, rigid plastic, or cardboard. Solid or semi-solid waste should be placed in durable, tear-resistant plastic bags. These bags should not be loaded beyond their weight or volume capacity. Keep the bags away from contact with sharp objects, and the waste should be packaged securely enough to ensure containment of the waste and to prevent penetration by rodents and vermin. The best practices for waste storage are as follows. The designated waste storage area should be located within the treatment center premises, away from food storage or food preparation areas. It should also be large enough to contain all the highly infectious healthcare waste produced by the hospital within 2 days, with spare capacity to cope with any maintenance or breakdown of the final disposal facility, such as the incinerator. The designated central waste storage facility should be totally enclosed and secured from unauthorized access and inaccessible to animals, insects, and birds. The waste storage facility should also be easy to clean and disinfect and must have an impermeable hard standing base, good water supply, drainage, and ventilation. Highly infectious waste and pathological waste should always be disposed of immediately. No waste should be stored for more than 2 days before being treated or disposed of. And there should be an adequate place dedicated for storing the highly infectious healthcare waste, which is in red bags and bins, separate from the general waste in black bags. All healthcare waste or disposal of medical equipment should be disposed of at the point of use by the person who used the item. In cases when used or contaminated material is found when not disposed of, or handed over to another person for disposal, the one who finds it or was given the responsibility of disposing of it should dispose of it. The following are rules or best practices for the transportation of healthcare waste. A covered trolley or a wheeled bin with a lid should be used to transport infectious waste from the collection point to a designated incineration point or pit. Infectious solid waste should not be transported by hand, as this increases the risk of accident or injury from infectious material or incorrectly disposed sharps. Red bags of highly infectious healthcare waste and black bags of non-hazardous healthcare waste should be collected on separate trolleys, painted and marked with the corresponding color codes. The collection route should be the most direct one from the collection point to the storage site, while still maintaining the unidirectional flow of the treatment center. When waste is to be moved to the final disposal site, special handling or packaging is necessary to keep bags intact and to ensure containment of the waste. The following procedure should be followed. Single-bagged waste and containers of sharps and liquids should be placed within a rigid or semi-rigid container such as a bucket, box, or carton lined with plastic bags. Infectious waste should not be compacted before treatment. This process could damage the packaging and disperse the contents, or it could interfere with the effectiveness of the treatment. Infectious waste should be transported in closed, leak-proof dumpsters or trucks when transported off-site. And the waste should be placed in rigid or semi-rigid, leak-proof containers before being loaded onto truck. All liquid waste, such as feces, urine, vomit, and liquid waste from washing, can be disposed of in the sanitary sewer or pit latrine. And PPE that includes utility gloves, mask, protective eyewear, and a plastic apron must be worn when handling and transporting liquid waste, even if it originated from a normally sterile body cavity. Solid waste should not be stored for more than 24 hours before being properly destroyed or disposed of. The area designated for the final treatment and disposal of waste should have controlled access to prevent entry by animals, untrained personnel, or unauthorized persons. And the biohazard sign should be prominently displayed. First, the sharps container must be sealed when it is 75% full. A health worker wearing PPE should place the sharps container in an appropriately labeled red bag. The neck of the bag should be tied and then taken to the final disposal site. High temperature incineration is recommended to be used at the final disposal site. The final ash and remains of the sharps should be buried in an ash pit.